said record. Okay. Okay. Hello, everybody. Welcome back to Misconceptions, to our podcast about maternal and perinatal mental health. We cover all different kinds of important topics. And today is really a unique conversation that I'm having with a friend and a colleague. It was something that I kind of been thinking about for a little while about. I would just love to have this conversation in general. I feel like we've had it a little bit almost like poolside when we're at conferences together. But we're going to be talking. I'm going to be talking today with Tiffany Conyers, who will help us navigate a conversation around what it means to be a faith-based practitioner. And for those of us who know me, know that I'm Jewish and work and live within the Orthodox Jewish field and community. And Tiffany is coming from a completely different faith. And we have had these very powerful conversations around faith and in the years that we've know each other. But I want to bring this conversation today about faith in what it means to be a practitioner, to be a therapist. One of the things that I've come to understand is that our maybe code of ethics, our guidelines from our NASW code of ethics doesn't always line up maybe the way that my own internal or faith-based code of ethics might line up. And how do we kind of a conversation that helps us kind of navigate that and just exploring what that means for both of us. Maybe this will appeal to the general population. Maybe some of you will be like, next episode, not really of interest to me, but boy, is this of interest to me. So Tiffany, thank you for joining me today on Misconceptions.
Oh, I am so delighted to have been asked to be sitting here with you. So thank you so much for having me.
Absolutely. So tell me about yourself professionally. Let's tell the audience, who are you and what are you bringing to the room as a professional?
All right. So, like Deborah said, I'm Tiffany. I am a licensed clinical social worker. I am licensed in the states of South Carolina and Georgia. I am a perinatal mental health certified professional. And so I have this angle of working with those in the reproductive journey from trying to conceive up into honestly empty nesting as I keep it going. We wherever you are in your parenting, I find that I have a passion for because I know it just takes so much out of us and it intersects with a lot of who we are. Um, and that I also am a parent, I am a wife. And I bring that into the spaces that I am in as well. And so I think what brought me into this world of perinatal mental health and just working with parents and those again, just trying to navigate all of that is my own journey. Being again a wife, a mom, having breastfeeding difficulties, not really knowing what to expect, being challenged by how I was raised and how I'm raising my own children, and then bringing that into the profession because I also noticed those were some common themes that many of the patients and clients that I was seeing dealing with too. It's like, well, I am bilingual. I speak Spanish and English fluently, and that's all I think really just ordained. It was like how just my life just set up in a way where Spanish was made available to me. I'm not a native speaker. I was not taught in a family that spoke Spanish. I was always around Spanish. It was just like my path is always crossed with those individuals who spoke Spanish. And it started as a child, and then I went ahead and said, hey, I'm gonna get a degree in Spanish. Just thinking like it's easy. Let me get an easy degree and then get a master's in something I really, really like. And that's what pushed me into social work. And that is, I think, one of the most diverse and unique professions. And I am so biased, Deborah. Like I'm coming from a real place where
I'm
people
with
ask,
you.
like, yeah, like I'm sorry, I'm so sorry. But it's true because we could social work as long as you have humans in places, you need a social worker in that space.
So
We
true.
provide not just case management and resourcefulness, but we provide clinical support. We help process things. We understand a lot of the nuances between person and environment and those that and how it influences our behaviors, our choices, and impacts who we are and how we will interact with the world around us. And just having that knowledge kind of really is valuable whenever there's people. So that's in jails, hospitals, in schools, on the street corners, in churches, in synagogues, in temples, and places of worship. Like having a social worker, be grateful. Be grateful that we're there.
Yeah. I think you could say, even just speaking to that idea, like I think social work has changed over the years. It used to be primarily case management, and boy, has it changed. And I think we are much more than that, but also have that lens of how we see the world, of caring for people on every level of their lives. It's not just therapy, it's therapy and what's going on at home and what's going on in the world around them. And do they have food on their table? And there's just more that goes into it. Yeah.
Absolutely. Yeah.
Can you just tell a little bit about, first of all, where are you located? What state do you live in?
Thanks. Okay, so yeah, I live in South Carolina now. This is where I am from. I grew up here primarily. The majority of my childhood was spent in the South, even though I was born in Detroit. And that's where I am now. I work along with Deborah in some capacity with Postpartum Support International. We do some really cool work there, teaching others about perinatal mental health. I also am an educator through the universities, and so I partner with a couple of universities and teach undergrad and graduate courses at my alma mater, which is the University of South Carolina, which I'm so excited about. It's almost very full circle, like walking into the social work
Amazing.
space, and I'm like,
Yeah.
I was a student here. And then when I'm interacting with students, realizing like I'm actually really old enough to be your mom, like in real life. You know what I'm saying? Like we
There's
were
so
having,
many. Yeah.
I
Yeah.
was having a
Yes.
whole like I'm gonna cry in the car later after class when I realized that none of y'all were born during 9/11.
Yeah. Yeah.
You know what I'm
Yeah.
saying? Like I was like, wait,
Absolutely.
how old am I?
Right. Right. Right.
Because I
Right.
was on this college campus when this
Yeah.
happened. And you all are like, sorry, Mrs. Conyers, we have no idea what you're talking about. Like, oh,
Right.
okay.
I think about that, like the things that influence who we become in this world, right? How something like our 9/11 experiences, who we were, where we were, how old are we when that happened, and then how that influences who we become. I think about when you say that when you're bilingual and yet wasn't actually specifically raised in a bilingual home, and yet look at how that has influenced the work that you do. And kind of more than just the work that we do, but also who we are.
Mm.
And maybe that would be like our segue into the conversation of what does it mean to you, and do you identify as, either professionally or just personally, as a faith-based practitioner, a faith-based therapist? How do you divide out that terminology?
You know, I'm also very reluctant in saying that I'm a faith-based therapist professionally because in my head, I'm like, I'm not ordained, because I'm not an ordained minister. So let me just, I am a Christian. I believe in Jesus Christ. I grew up in various capacities of church. So I attended a Baptist church, and then right now I'm part of a non-denominational faith-based church. And so when I think about like whether I would put that as like I'm a faith-based therapist, I would be like, oh, but they, that I'm not a reverend or I'm not a pastor, I'm not a minister, even though I do incorporate faith, even in the work that I do behind the scenes as a therapist, you know, um, and my Christianity does show up personally in how I decide things and how I move forward, even in business, in my home, what I'm doing with my own children. So it's so interesting that you say that because in my head, I'm like, oh, don't put that on me, even though I do identify as Christian on most platforms for those that are looking for a therapist, because they'll say, do
Right.
you identify with a particular religion or faith orientation? And I'll say Christian because it's true, it's true. And that may make or break or be the reason why someone is drawn to me as a therapist for them, or why they may say like I'm good.
Right.
No thanks.
Right. Not for me. It's
Yeah.
interesting because I would define for myself a faith-based practitioner a little bit differently. I never even thought of it as like, am I an ordained rabbi or an ordained,
Yeah.
have any kind of like certification that kind of goes along with my faith. Which is also it's an interesting perspective.
Hmm.
I have
Hmm.
always been I've always seen faith-based practitioners as people who are very defined, meaning their work is always through the lens of their faith practice. So I think it's primarily, I've seen it through the Christian faith of like, I am a Christian-based practitioner, which means that I incorporate my faith into our therapy sessions,
Hmm.
or we will talk a lot about faith if you want to.
If you
I'm
want to.
comfortable
Yeah.
exploring, Christian-based philosophy in what the work that we do. But yet I agree with you. I also do not like promote myself as a faith-based practitioner. And I guess I would define that as I am very careful in my choice has been to be very careful in like a boundary of like not invoking my faith or even incorporating my faith very overtly or
Hmm.
covertly into the
Right.
therapy work that I do, even with my religious clients.
Hmm.
So that's been an interesting thing to navigate where I know that they're faith based or that they are faith practitioners. And yet I'm very hesitant to say anything that's like of spiritual or religious in nature unless I like couch it, unless I say, well, can I have your permission? And the word I'll use
Hmm.
is to put my Rebbitzin hat on. A Rebbitzin is the wife of
Hmm.
a rabbi. We, in the Orthodox tradition, we don't have like ordination
Hmm.
in the of women typically. So I don't have like an ordination kind of label, but I would say as a Rebbitzin, can I put my Rebbitzin hat on for a minute?
Hmm.
And it's
Hmm.
been really interesting. Sometimes I actually do it with some of my non-Jewish clients as well. I'll be like, can we have this conversation? Are you okay with us having this conversation? Because I mean, how can I not? But I do think
Yeah.
it's a bit of a dance. And I'm wondering what you feel when you're if you hear people that are identify themselves as Christian or faith-based in whatever capacity, and what you're hearing doesn't line up with your perception of God or the world or the way God runs the world, how do
Hmm.
you kind of navigate that either interpersonally, emotionally with the client in your own head? Like, I want to talk about that.
That's so good because it's true. And it reminds me of our professional training. The philosophies of social work does, they give us this, hey, we don't bring up religion. We don't bring up certain things. We don't want to be in any position where we're pushing and putting on the client, your stuff or your bias and all of that. And so even having to share that with students, I'm like, hey, but you can't really deny who you are. That even your interaction with your client is going to be based on maybe your own spirituality and your own faith orientation too. And I think it does show up in therapeutic relationships. When I hear a client, because we're in this perinatal field, and sometimes they're dealing with loss, they're dealing with really complicated, complex issues. And I remember some clients really believing that they were being punished by God for what they were encountering, for what they had to endure. And so it was like, oh, okay. Based on my relationship and my understanding of who God is, in my own walk, I'm like, that's not even God's nature now, through my
Yes,
faith lens. I'm like, that's not, we live in a fallen world. You're exposed to some really hard things because of the spaces that we're in, because we're all here on this earth. But you can overcome and you can endure and you can get strength and you can get support and you can get, but to hear a client say I'm being punished, then and having to say to myself, who am I to say that they aren't being, like how can I try
yes,
to offer hope and a different point of view when maybe that's really at the core of who they are and what they believe. So I think
right,
that's often where it kind of intersects, where I may want to say through a lens of optimism, if without their permission say something that gives hope but maybe even denies them, and I don't want to do that either. Like, how can
sure.
I help you cope with the fact that you're being punished?
Right.
Rather than
Right. And yet, and then I also feel sometimes like that desire to, especially when there's like a strong age differential, I almost like become the older mother in the room or the older woman of like, can I offer you an alternative to that faith perspective?
Mhm.
Obviously with their permission, but it almost feels like a responsibility. Like I know something different or I've been taught something different. And so you and I have the same faith. And why is it that your perspective is punishment and mine might be a little bit different? And I almost feel obligated like to teach them that, like to say,
Mhm.
well, or who can we have you go talk to,
Exactly.
right? To go have that conversation because I think there might be another way of looking at this. But it's an interesting dance, isn't it? That like
Ah,
I know what I know, but I can't necessarily teach or instruct in these spaces, right? If you were my
mm.
student, could have a very different conversation, but not as my client.
Exactly, exactly. And so, again, with permission, we can probably offer a reframe, or maybe even for me, if a client is okay with us being allowing our Christianity to inform our work together, and we can deal practically with what's happening in their lives through their lens, but then also give perspective through the Word of God, through the Bible. Then, with that permission, I will incorporate some things. And then, like you said, instruct them to talk to their faith-based leader, their spiritual leader, regarding some things. If I feel like, yeah, I think I might be stepping on some toes here, because
Right,
that isn't the
right.
case. That's not my Jesus. My Jesus wouldn't do that to you, girl. Like, wait, I can't do that. That's not my role.
Right, right. But sometimes we want to. Sometimes we really, really
Absolutely.
want to. Yeah,
Absolutely.
absolutely. What about when you hear a client say things that like trouble you, maybe like in the perspective of doing something that you know is against the faith and they're doing it anyway, and you kind of I think sometimes I hear it as like, oh, this is going to be so hard for you to manage afterward, like the aftermath of the decision or of the choices that you're making right now are going to be very complex
Mhm.
socially or emotionally or spiritually for you. What are some of the things that come up for you when you think about that perspective?
So this has definitely come up, and it's so interesting. Well, Deborah, you know this, but I'm a bereaved mom, and so I've experienced a miscarriage. I've also experienced neonatal death. Our son had a prognosis, our baby Miles, in 2020, and he passed away 3 hours after he was born due to complications with trisomy 13. And we were offered the opportunity to terminate, because that prognosis is incompatible with life. And so, having this lived experience as a perinatal practitioner provider, and also someone in their own reproductive journey of having to consider termination of a pregnancy, and how that intersects with faith, how that intersects with specific rules or understandings of how you govern yourself through the lens of Christianity, through the lens of a faith orientation. And that can be really tough, because you're kind of like doing again this dance. But that comes up often when clients are thinking about and considering termination, in particular, that's shown up. It's also shown up in marriage, when they're talking about their own marriage and marital issues, and how they want to now have an open marriage, and they're also Christian, and they have this faith that you're like, this actually doesn't line up with with your faith. But they're
Show me
like, you
where
know
it's
what?
acceptable. Yeah,
Right?
exactly.
Like, I'm just trying to understand.
Right.
Okay, but because I
Mhm.
also know on the other side of whatever decision they make, whether it is to terminate, there may be grief involved. If whatever decision they make regarding having an open marriage or cheating on their spouse or whatever they call it, there are going to be some consequences emotionally, maybe even physically. There could be some spiritual, so you kind of
Yeah.
know, and that you potentially may be facing more issues if you choose either way,
Yeah.
whatever you decide.
Yeah. Yeah.
And having being there for them. Let's fluff out. Let's talk about what either decision looks like for you, whatever you're deciding or thinking about doing. And this knowing I'm going to be here on the other side of that decision to help you process and navigate whatever comes with it.
Yeah. I think what you bring up that idea of like when somebody who is from a faith community makes decisions that either are maybe in conflict to the faith or maybe even in the margins of the faith. I also work with women and couples who are coping with termination specifically for medical reasons, and I have yet to meet anybody who has told anyone that that's what they chose. And for anybody who might be hearing this conversation, you might say, "Oh, well, we don't do that in the Orthodox community." I'm like, "Oh, yes, we do."
Mhm.
And it's termination of pregnancy is something that is happening and is being addressed, especially when there's a medical risk to the mother for sure, but also when there is something wrong with the baby. And that would be a conversation for another time. But I want us to make sure that we're clear that this is something that our Orthodox community members are dealing with, but on the outside, they're telling everybody they had a stillbirth. And so that means that what kind of support is available to you is going to change when you're living in a faith community and you make a decision that might feel on the margins. Even if it was done with rabbinic or pastoral guidance, it still would be considered on the margins. And I think that people find themselves incredibly isolated because of that. And then I remember working with somebody, actually, it was such an interesting consultation. It was a consultation with someone who was considering termination, who was Catholic. And this is a person who was deeply involved in her church, like on a very high level. And she was dealing with a baby who was incredibly ill and incompatible with life. And her perspective was, if I do this, and she was being strongly encouraged to do this, she's like, if I do this, I will not be able to be either to bury my baby in the cemetery, or I won't be able to be buried in the cemetery. And like it had so many ramifications that I felt like also were not being discussed by the physicians, right? The physicians or the genetic counselors were not addressing the implications of these choices when that person then has to go back to their faith community.
Right.
Right.
Yeah. Yeah. I keep I'm sorry, I keep bringing up intersectionality, but a lot of this intersects, because you are part of a faith community, you are who you are, and then you're also pregnant. And then you're also trying to build your family, or you're trying to navigate marriage and getting married, courting, and all that comes with it, and thinking of how that connects with my faith, how I decide and choose through the lens of my faith and through the lens of my religion and the rituals and practices, beliefs of it, and then also deal with the emotions that come with it and deal with that. And I think that's for our clients. But think about us as therapists, because again, we know a lot. We know what this can potentially do for a person, and how even being isolated or exiled from their church, their community, their faith community, the consequences of that on them personally. So it's a lot. It's definitely a dance. You definitely equated that very well to a dance. It's a dance.
Yeah. I think it's important as well. Like when I think sometimes I get off of a call or I finished with a client, and there's parts of me that are just like, I want to scream. And sometimes I do. I just scream a little bit and just be like, oh, this is so complicated, right? Like my own feelings. And then I think this might be an important place to pick up when we feel our own, maybe could I say, disappointment or frustration with God, right? Like this had to happen to really, God, there's nobody else you could have put this bad thing on. Like this person's gone through so much. And especially for those of us, and you as well, that I know have worked so deeply within the lost community, it's like really, the recurrent loss community, the people who are struggling with loss after loss after loss. And you're like, you have got to be kidding me. Like, that's what was necessary, God. Like, I feel like I have my list. I jokingly, that's what Justin would say. Like, I got a list of things that I got to bring to God when I die. I hope I'm a very old lady, but like, really, God, you got to explain this one to me, because I know there must have been a rationale behind it, but I'm having a hard time understanding it.
Yeah.
And so, can we talk a bit about when you are faced with the tragedies of the world? Talk to me about your faith. What grounds you, holds you, or do you struggle with when coping with the traumas and the tragedies of the people that we work with?
Man, it is tough, and I think my faith offers some hope. And that's why I was like, ugh, I really have to lean on faith when I think of some of the complicated, complex grief and trauma that many of our clients experience. And I think that is um, that's a source of almost peace. But I do grapple with, like, why did this happen? I may not ever get this answer, God, or if I do see you, like when I do see you later, long time from now.
At least 120.
Right. I got a couple of things I do need to see here on earth first. But when I see you, I got some questions like, what happened here? So I really do. I find hope in a scripture that says all things will work together for the good of those who love the Lord. And that was like, okay, even if bad stuff happened, somehow this bad thing, somehow this traumatic experience for my client will turn into something that they can find joy in, or maybe some type of solace that it happened to me, but through what happened to me, I'm able to help somebody else. Or
Mm,
on the other side of it, it's something that can produce something beautiful later, even though it's really hard now. So that's kind of one of the things that I can lean on and put a hat on in Christianity and that faith that can help me be there for them, and almost grieve personally on my own terms and on my own time, praying for them. Because that's what I said about earlier. I was like, listen, my faith shows up in how I'm running my business. How I believe God that clients are coming to me, that they're sent to me, that there's this relationship that God wants me to have with them to help provide them with a sense of support and recovery in whatever they're experiencing. So I do think that it's not just like circumstantial and haphazard that I get the clients that I have. I really do believe that through my faith lens that I'm supposed to interact with them, and that we
yeah.
that I'm honored to be a part of their journey
Yeah.
towards healing or recovery or whatever that may look like for them. Mhm.
I feel so strongly about that because I feel like somebody will say to me, what you said to me, and sometimes I have no idea what I said to them, but when I remember, they'll say
Yeah.
to me, what you said to me in our last session, or they'll text me or email me and say, like, that really changed things for me, or that really helped me, or that's exactly what I needed. And Tiffany, like, I know you agree with me. Like, it wasn't in any of my books, right? It's not in our textbooks. And when those things happen, I so deeply feel God on my shoulder. I
Mhm.
feel him he put the words in my mouth.
Yeah.
There was a prayer that we say before there's a prayer before the prayer. God,
Mhm.
open my mouth. Hashem sefasai tiftach. Hashem, open my
Mhm.
lips. The completion of that is ufi yagid tehilatecha, and my mouth will sing your praise. But I also feel like when I speak, and when I'm able to find the words of solace or comfort or direction or whatever it is that that person needs, I so deeply feel connected to God in those moments where I feel like you just described, like that he guided that person to me, but also I feel guided by him because, like you said, I don't, it's not in our books. These are not things we learned in social work school.
Yeah.
And sometimes it will help future people, and sometimes it was just what that person needed in that moment.
Exactly. Exactly.
Yeah.
Yeah, that's man, it's so powerful because I do believe in that same concept of this ordained relationship. Like we're
Mm-hmm.
supposed to be in this moment together at this
Right.
time working on this thing as you face
Right.
this issue, like it's a
Yeah.
and having you know, for me, like the Holy Spirit kind of really being a part of our therapeutic process too. And they may not know it. They don't know that
Yep.
that's what I'm leaning on sometimes to get through. Like we have some theories and some therapeutic models and modalities that we do follow,
Mm-hmm. Yes. Yes. Yes.
there's some
Absolutely.
interventions, like we're not out here just, but there is something about those moments that I
Yeah.
remember in my mentoring, becoming a clinical social worker. My mentor would call it's when the magic happens. And I
Yes.
think that was
Agreed.
their way of being able to
Yeah.
explain what happens in that therapeutic
Yeah.
relationship.
Yeah.
And through my lens as like a Christian, I was like, it's not magic. like as there's nothing witchy or spooky,
Yes.
magical
Yes.
about that. Like
Right.
it's a spiritual thing, like in my head. But
Right. It
I
does
didn't
feel like
correct him.
magic though sometimes.
It
It
does.
definitely does feel like magic. But I think that that really speaks to that, to that concept of like what's the difference between us as therapists versus a pastor or a rabbi, and what's the value of being a therapist. It is part of us. We have our faith that we lean on, that guides us, that supports us, that is in many ways who I am versus what I do. But it also is, but what comes along with this is all the stuff in the book, right? The
Hmm.
stuff in the books is what qualifies me to also learn the boundaries between being exclusively focusing on the faithful response versus no, there's mental health and there's issues that people are dealing with that, yes, therapeutically, there are modalities that will support them. And there's this other piece of it that like kind of strengthens me. It's like my foundation of who I am that I think
Exactly.
makes me a better therapist, you
Yeah,
know?
you brought up something just now that reminded me of many of the clients that I've seen have conflict in their faith. And so being almost a representative of a different point of view through faith, or a safe place for them to discuss their faith and maybe the challenges that they're having in being mad at God, or not really recognizing that there is a God. Like they're like, I'm just struggling right now because I grew up believing this, and right now I just don't feel connected to that religion or that philosophy anymore. And being, again, a safe place for them to explore that and understand that without me pushing my beliefs on them. I think that allows for, again, for me, like I'm a representative of, because they know I'm Christian, because I did post it. I could be a representation of a Christian that can hear them and not judge them, and the Christian social worker that is not going to push values and beliefs on them, but just offer them a space to actually really process that I'm struggling with my Christianity. I'm struggling with my faith. With many clients do. I have, because I'm a person of color, I'm Black. Um, I'm Black, y'all. Anyway, because of that, I often do see more clients who are people of color. I'm bilingual, I speak Spanish. So those who may be part of marginalized and more oppressed groups in the United States may come to me and feel maybe some solidarity or even safe,
Right.
yeah, in the therapeutic process. And that's one thing that's been brought up when they talk about their Christian faith is I've been told all my life about this Jesus, and then I'm still kind of grappling with, is this the same savior that would allow bad things to happen? Is this the same Jesus that died for my sins, but also was used to oppress a whole bunch of Black, brown faces in enslavement? So there's this natural conflict sometimes with, those in the Christian faith who are coming to terms with, how can I believe in a God that was used to oppress me? How do I believe in a faith that was used to oppress my ancestors? And what does that look like? And this, for me, it's like one of those identity crises that many people just go through in general, whatever, in whatever walk, whatever faith. It's kind of like, why do I believe this again? And so they're having to discover their spiritual walk and their faith walk, sometimes on their own, without the support of family. And therapy can be a place for that,
Yeah, totally. It can be a place for that. And also that's also partly, I think that is going to also speak to the skill of the therapist. The therapist has to have like a faith-based practitioner has to be, I don't know why I keep going like this, because I guess I don't really fully identify that way, but let's just say it. Like, so a faith-based practitioner has to be able to navigate holding their faith identity and helping to support whatever that journey is for the clients that we serve, without them ever feeling like either they're failing us or failing the relationship that you and I have, client to therapist. And I think that that's maybe one of those spaces where if they were to speak to a rabbi or a pastor, they might feel not welcomed in having that conversation if the result is they walk from their faith or they walk back from their faith. And that, I think, is being who we are in our own faith experiences, and as hopefully excellent therapists, we can help them kind of find their spaces on their own, but in a way that feels non-shaming, non-judgmental, a safe place to explore it, but also understanding what it would mean for them if they did walk back, what it would mean interpersonally and socially and spiritually, what it means for them.
Yeah. I think you're right. It does take some skill and being almost solid in who you are, because it's a fine line where you start projecting. You could be doing some countertransference here if you are hearing someone talk bad about your God.
That's right.
Or
That's
thinking
right.
about turning away from this faith, and how much your walk means to you, how you potentially could be more paternalistic or push on a belief system when they're not really ready. And because they have to do this really internal work and this exploration on their own, or with the support of a therapeutic faith-based therapist. It reminds me of
Yeah.
chaplains. You know how chaplains really are
Yes.
kind of
Yes.
supposed to be like,
Neutral.
yeah,
Right.
yeah.
Right. Neutral faith. I'm not sure how that really works out in practice, but yes,
Either.
neutral. I'll tell you a funny story. When my baby was, when one of my children was born, and it actually was like I think it was St. Joseph's Hospital in Arizona, and one of the nurses who was, I think she was either a chaplain or a nurse, came in. She must have been a chaplain, and she said, "May I offer a blessing to the baby?" We were getting discharged. And my husband and I looked at each other. We're like, I'm not sure how we feel about that. And he was great about it. And he goes,
Yeah.
as long as it's an ecumenical blessing, like more neutral,
Yeah,
right?
yeah.
And she offered a lovely prayer, but she also did something called the laying of the hands. She put the hands on the baby. And the two of us were like, ooh, that holds a very different ritualistic
Yeah,
experience within
yeah.
in the Jewish tradition. Would not wasn't necessarily something I was so comfortable with, but was super sweet because I actually had gone in for a meeting with them a couple of months later to talk about some of the cultural needs of the religious community. And she's like, "Is there anything else I should know?" And I was like, "Well, while you're asking, let me talk to you about the laying of the hands." But I feel like, some to comfortably navigate some of these spaces, to find that conversation that works on both sides is part of navigating, kind of the world and the therapeutic relationship in general. Is there anything else that I have not brought up about being a faith practitioner that you want to make sure that we cover before I ask you my final question?
Oh, this has been such a rich conversation that I don't get to have as often,
Yeah. Yeah.
Um,
I do these conversations totally for selfish reasons, by the way. I
yeah.
did this podcast because I want to talk to all these people.
I'm fine with it. I'm enjoying myself.
Okay, good. So let me ask you like this. In wrapping up our conversation today, what would you say are the top three misconceptions you might put out about being a faith-filled, I'm going to call you faith-filled versus faith-based. How's that? A faith-filled
Uh,
practitioner. What would you like people to know?
oh, wow, that I'm going to push my religion on you or
Okay.
push my faith on you. That's a misconception. So if you see Christian or Muslim or Jewish or
Jewish.
Orthodox, like yeah, like if you see any of those on like maybe your platforms where you're looking for a therapist, that doesn't mean that I'm going to be pushing that on you, that you can't cuss during your therapeutic session. Like
Yes.
like it's cool. I can handle hearing if you just smoke the blunt. Like I can handle that.
Right.
Like I'm good. Like it's okay. So
Right.
I think that's definitely a misconception. Oh man, I think that's the biggest one for me. I'm trying to think of some other misconceptions. Oh, that I may not be able to handle when you've maybe if you're processing a sin, that I may not
Mm,
be able to handle that, or that I'm going to judge you for that. I think that's a misconception when you're thinking about a therapist, the idea that you can't safely talk about maybe the things that you've done because maybe you aren't ready to talk about it, or you don't think that I'm going to be able to, I can handle it, or we can support you through that. And being faith filled for me means that again, I can hold them, I can hold my clients in this space, and that in my faith, like through my faith, can support you
mm.
in that. So I don't know. I don't know if I got three misconceptions, but
I'll give
those
you
are
the
the,
two. I'll give you
thank
two.
you.
You know what? I have one last question for you.
Okay.
Do you pray for your clients? And do you tell them that you pray for them? No.
No, so I'm
No.
shaking my head and nodding my head, y'all. So yes, I do pray for my clients, but I don't tell them I pray for my clients. And it's weird
Yeah.
because it sounds like, wait a minute, are we praying for me? What you saying? It's really that they can get all that they need out of this
Yes.
therapeutic relationship. It's
Yeah.
through that lens of prayer that they can find recovery, that we can peel back some layers, and that they can achieve the goals that they're setting in therapy. That's
Yeah.
really a lot of the prayer. If I hear that my client is about to have surgery or they're about to experience something medically, I do, lift them up in prayer,
Yeah.
so that things go well with them. It's not to push any philosophy or anything on them, but it's really so that they are able to get the best that they can get from me and
Yeah.
from their life as they are learning some new skills to
Yeah.
achieve the goals that
Yeah.
they're setting. So yeah.
I have loved this conversation. Thank you. Thank you. So unique, so different, not one we have typically. And I appreciate this time that you've chosen to spend with me, Tiffany. Thank you.
You're
Thank
so
you. Thank
welcome. Thank you.
you.